Your brain needs support, and new Ollie Brainy Chews are a delightful way to take care of your cognitive health. Made with scientifically backed ingredients like Thai ginger, L-theanine, and caffeine, Brainy Chews support healthy brain function and help you find your focus, stay chill, or get energized. Be kind to your mind and get these nootropic chews at ollie.com. That's OLLY.com. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by a guest pediatrician bestie, Dr. Erin Faherty, who's a pediatric cardiologist who treats kiddos at Yale New Haven Children's Hospital. She also went to med school with my husband, Ethan, so this is a very special episode for me. Okay, so today we are going to talk about heart murmurs. The clock is ticking, so let's get to it. So, Erin, this topic is near and dear to my heart, pun intended, because both of my children were diagnosed with murmurs when they were quite young, when they were infants. So can you tell us, what is a heart murmur?
Sure. So usually when we listen to the heart, there are two distinct sounds, described as often what we think is the lub-dub, if you will. And these are sounds actually of the heart valves opening and closing. So a heart murmur is just a sound that's appreciated beyond the expected two heart sounds. And a heart murmur actually may just be from blood flowing through a healthy heart, or it could be from a heart problem. And I often think, as you mentioned, Jessica, that when parents hear about their child having a heart murmur, it's really scary. Because a heart murmur often is thought as, well, then there must be something wrong with the heart. But actually, fortunately, this is not usually the case for kids.
So how common are heart murmurs in kids? Because I feel like I've heard this quite a bit from my friends and obviously, for my own kids. So how common are they?
So heart murmurs are very, very common in kids. In fact, greater than 80% of children at some point in their childhood have a heart murmur. Oftentimes, these murmurs actually sometimes just come and go, or oftentimes these murmurs may outgrow them. Unfortunately, most of the time, these heart murmurs are called innocent heart murmurs. That means that the heart is healthy without any structural heart abnormalities, and the murmur appreciated is the sound of blood flowing through a healthy heart. And when speaking with parents, I often describe its likeness to hearing water flowing in a pipe. In fact, only about 1% of children have a structural heart defect.
So how does a pediatric cardiologist evaluate kids with heart murmurs? How do we know whether there is a structural issue that you just mentioned is quite rare versus an innocent heart murmur?
Sure. So a cardiologist, of course, will, take a careful history, but the physical exam is really the most important. So the physical exam will include a careful auscultation of the heart and its sounds using a stethoscope, of course. And as cardiologists, we'll describe heart murmurs by the quality and the intensity, as well as where the murmur is best heard on the chest. And for a pediatric cardiologist, an innocent heart murmur sounds very different to us than a murmur from a heart problem. And so sometimes just a good physical exam will let us know that the heart murmur is just innocent and nothing to do about it, and likely the child will outgrow. If we are a little bit more suspicious for a possible underlying heart problem, as a cardiologist, we'll perform, again, an EKG, which looks at the rhythm of the heart in a screening tool, but we'll also perform an echocardiogram, which looks at the structure of the heart as well as the function of the heart.
So what kinds of heart problems can cause a heart murmur?
Sure. So heart problems that can cause heart murmurs in kids include defects or holes in the walls between the lower or upper chambers of the heart. This is probably one of the most common causes. There also can be valve abnormalities that a child either was born with or developed that causes valves to leak or be narrowed, or sometimes problems with the heart muscle's ability to pump normally. And fortunately, pediatric cardiologists are well versed in all of these potential problems and know how to help if a murmur is found to be from a problem of the heart.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. Special thanks to Dr. Erin Faherty, pediatric cardiologist, for her time and expertise. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, U.S. versus China, where I'll take you behind the scenes in the tumultuous U.S.-China relationship. Find Face Off wherever you get your podcasts.